Welcome to today's webinar. This is part 3 of the 4-part Cardiogenic Shock Registry Research Series. This webinar is called Abstracts, Preparing and Presenting. My name is Melissa Clark. I'm the Program Manager for the Cardiogenic Shock Registry. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Although there are no CEs available for this webinar, all attendees of the live event will receive a participation certificate of attendance that will come along with the recording, which you'll receive in an email around 2 hours after the event is over. The presentation is also available as a handout, which you can download via the handout pane of the control panel. You'll have the opportunity to submit text questions by typing them into the questions pane of the control panel. And you can send your questions in at any time, and we'll during the presentation, and we'll collect these and address them during the Q&A session at the end of today's presentation. If you experience any technical difficulties during the presentation, most can be resolved by refreshing your browser, but if that doesn't help the issue, you can log off and log back on. And when you log on, use the Chrome browser. That seems to work better with this platform. You can also contact the customer service representative team from GoToWebinar. Their information and their contact information is included in the registration email that you received. And to view the live closed captioning for the webinar, please utilize the hyperlink that is in the chat. And I will add that again right now. There you go. Okay, our panelist today is Dr. JoAnn Lindenfeld. She serves as our co-chair of the Cardiogenic Shock Registry Research and Publications Committee. She's also a professor of medicine at Vanderbilt University Medical Center in Nashville, Tennessee. She's a previous president of the Heart Failure Society of America and has served as the chair of the FHFSA heart failure guidelines in the years 2006 and 2010. So I'd like to welcome her at this time. Thank you, Dr. Lindenfeld, for being here with us today.
Thank you, Melissa. It's a real pleasure to be a part of the Cardiogenic Shock Registry. So I'm excited to tell you about how to participate. And the goal of these seminars is for really to us involve people who wish to be involved even more than they have been in the past, and also may wish to actually be presenting abstracts and papers as part of the registry. And we would, as the steering committee, we would love to have that happen. So I hope this will be helpful to you. So the Cardiogenic Shock Registry is powered by Get With The Guidelines, and you're all familiar with a number of other Get With The Guidelines that I'm showing you here. Let me show you next. I'm going to give you a minute to look at my disclosures. And then Melissa has already told you some of this, so I will now move on to what I'm going to cover today. And I want to talk just a bit about why should you do an abstract? What was the reason for doing an abstract? What makes a good abstract? And then how to prepare an abstract. And in that, we will cover formatting and style rules, talk about the structure of the abstract, and then it's important to talk about who is your audience, because in the end of this, you will see that thinking about who is your audience helps you to go back, look at your abstract and say, will this meet my audience's needs? Will they understand this? And then a bit about presenting the abstract. So why do we do abstracts? Well, the most important thing is scientific contribution and feedback. The idea is to get data out there earlier. We see data earlier than we used to 20 years ago, but this is still a really important way to contribute to science and to get feedback, interaction, collaboration, and maybe perhaps even redirect some of what you're doing when you get really good feedback. Abstracts are always for networking and collaboration and professional development and recognition. And let me just go into those just for a minute each. So scientific contribution and feedback, again, the most important. We would like to disseminate our findings early in order to get feedback, potentially if we have data that will apply right now to patient care, to advance patient care, and to create awareness and excitement about your area of study so that hopefully other people will be excited and can contribute to this, because as you know, medicine is sort of a group sport. It's a lot of little advancements all put together. So these are all the reasons for scientific contribution, all the things in scientific contribution and feedback. But also with an abstract, you get networking and collaboration. You can build relationships. People ask questions or see you after your poster presentation or after your oral presentation. And you may even develop collaborations. You may find mentors and people who are interested in the topic you're interested in. You can engage experts yourself when they pass by your poster or are attending your oral presentation. And it opens up future opportunities to collaborate with people and to open up your area of investigation. And finally, abstracts are important for your professional development. It helps you establish expertise and have a track record of expertise and become known. So there's career advancement when you're presenting at national meetings. It helps with promotion. It helps with a national reputation, particularly when you present at the American Heart Association scientific sessions, a major national meeting, and may help with awards and funding. The other thing about an abstract is that it helps you structure the abstract, and you learn by structuring the abstract how to structure your manuscript, what's important. So finally, what makes a good abstract? Give yourself enough time. I want to spend just another bit on give yourself enough time, and we'll come back to these other issues. So this seems like a lot of time. I know you see abstracts being done at the last minute, but when you start off, I would encourage you to give yourself enough time, probably at least 5 weeks. And let me just show you about the timeline that I think is valuable when you do this. If you want to get the most out of the abstract presentation and get the most collaboration and feedback, the way to do it is to start in advance. About a week to prepare and have your senior author review your abstract to make sure it's ready to go out to your collaborators. Then when you send it out to your colleagues that are also on the abstract, you'll want to give them at least a week generally to look at the abstract and respond with their feedback. And then you probably need another week. You may be faster, but I would give yourself another week to make the revisions. If they're extensive, you may want to pass it by your colleagues again, or at least certainly have your senior author review the revisions that you get from your colleagues. And then remember, if you do an abstract from the Get with the Guidelines with the Cardiogenic Shock Registry, we need that abstract in 7 business days prior to the submission deadline to submit to the steering committee for review. So the steering committee has to review your abstract and make sure it meets sort of the criteria that we've set for what constitutes a straightforward informational abstract. And then you'll get back, you may get back with a few comments, so it would be good to give yourself a week or so to make the changes. And if there are a number of changes, maybe to have it reviewed by your colleagues and then submit. I would give yourself more than a day or two to submit. Sometimes you don't have everybody's email exactly the way you want it when you get ready to submit. So give yourself enough time, particularly the first few times you do this. You're going to get much, much better feedback from your colleagues if they actually have time to review it and don't have things that we have to send this in tomorrow, please review it tonight. So what are the other things that are important? Well, I think the most important thing about an abstract is be concise. Use simple sentences. When I say be concise, it always reminds me of Abraham Lincoln's very famous quote that said, if I'd had more time, I'd have written you a shorter letter. When you have time, you can consolidate and be concise. And use simple sentences. This isn't the time to use big words or big long sentences. Avoid unnecessary data. You want to be sure that your title tells people what you're going to talk about. Your methods tell you how, the background tells you why you did it. The hypothesis tells you what your hypothesis is. And then you provide the appropriate methods, results, and conclusions. So again, avoid unnecessary data and provide a background for the hypothesis. And we'll get into each of these, each of the structure of the abstract a little bit with some tips for that. Don't give more results than you need. Provide the primary results on which you will base your conclusion. And make each of these, the hypothesis, the data, the results, and the conclusions, as clear as possible. This is why it's good to give yourself some time so that you read it again and again and say, is this clear to everyone? All right. So I think here's just a typical AHA abstract. Other organizations have slightly different criteria. but the character limits are about 1950 for the body of the abstract. That excludes graphics, which are about 250 characters for either a table or a figure. This doesn't include the title or the authors or spaces. In general, you shouldn't have more than 3 abbreviations in an abstract because it gets to be too much for an abstract. Drug names should be generic. Don't start your sentences with a number. That's a good rule for your manuscript as well. Provide the number of subjects in your study and the data that supports the hypothesis. And exclusions, there should be no references, credits, grant information, or any personal information like patient names in an abstract. So the structure of the abstract for AHA scientific sessions are the title, the background, the hypothesis, the methods, the results with or without a figure or a table, and conclusions. And I would like to make just a few comments about each of these. So for the title should be dynamic and conclusive rather than declarative. So here's what I mean. So take 2 separate titles, for example, for the COAP trial, which was the trial of transcatheter mitral repair and secondary mitral regurgitation. You could say transcatheter mitral valve repair in patients with heart failure. Or you could say transcatheter mitral valve repair reduces cardiovascular mortality and heart failure hospitalizations in patients with heart failure. That's a very conclusive and dynamic statement that tells your audience what your data are going to show and what your point is. For the background, it's best to use a problem statement approach. So, and no more than 1 or 2 sentences. So you might say, despite decades of use, the benefit of intra-aortic balloon pump utilization is poorly studied in cardiogenic shock due to acute heart failure. Or you could say, randomized information is lacking for the benefit of intra-aortic balloon pump in cardiogenic shock due to acute heart failure. Both of these tell your audience exactly what is known at the current time about the topic that you're going to be discussing. And I would point out also when you do the background, remember that you want to make sure that people who aren't experts in cardiogenic shock will be able to understand what the background is. So make sure it's understood by those not in the field. Cardiologists often, but or people in the cardiac field, but not necessarily in cardiogenic shock. If possible, you should state your hypothesis in 1 sentence. For example, we assessed the effect of intra-aortic balloon pump in patients with cardiogenic shock due to acute heart failure. Make it very clear. The methods, again, remember these are short, so no more than you absolutely have to put in here. But the method should describe your approach. Is it randomized? Is it retrospective? Is it a cohort study? What is the intervention? What is your primary endpoint? And the number of subjects, unless you're going to include that in the results. So the results are key findings with effect measures such as confidence intervals, hazard or risk ratios, and the p-value, a sample size, and the mean study duration if there's room. Now, what about a figure or a table? Well, we've all heard that a picture is worth 1,000 words, and I think that's often true, but I'd like to just give you a couple of examples. I just want to make the point here that if you use a figure or a table, you want to be sure that it's very clear, easy to see, and it's very easy. It makes its point without having to look at it and search around in it. So it's just sort of a important thing. A figure or a table might enhance clarity, but should only be done if it conveys essential information more efficiently than the text. So I'll give you some examples, but look at your figure. Does it draw the reader's eye, and does it really transfer essential information more efficiently than you could with a couple of sentences? In almost all cases, and usually most abstracts only allow 1 table or 1 figure. And then only again, if they present the information in less space in a more easily interpretable way than the sentence form. And I've included here a couple of references that are older, but a nice description of why you write an abstract. So the advantages of a figure is that they're a powerful visual statement. they're easy and fast to interpret, and it catches the reviewer's attention. But they have to be clear. And again, you don't want to use them unless they're clearer than what you could do in the text. And they do take up space, as I said, about 250 characters per figure or table. So let me just give you a couple of examples. So here are 3 ways to look at it. One is the figure you see on the left, and then you can see a table, and then you can see the text. So I think this figure, sort of, if it's titled Review of Xfinity Customer Service, I think you can see that the figure pretty clearly communicates the point. And it gives you an idea of the numbers. You don't see the actual end, but you see the rough numbers. And I think this is one that's very clear. Now, to use a more medical one, here's different parts of the COAPT trial. So you see in the top left, the figure of heart failure hospitalizations. You see the marked difference. You see the p-value, the hazard ratio. The X and Y axes are listed. So that, I think, is a very important declarative figure, which draws your attention immediately. And probably clearer than either the table below that expresses the same thing or the text that expresses the same thing. So an example of why you would put a figure in an abstract. And then for the conclusions, you should summarize the interpretation, and you should emphasize if it's new information and the implications. For example, just using the COAPT trial again, among patients with heart failure and moderate to severe or severe secondary mitral regurgitation, transcatheter mitral valve repair resulted in a lower rate of hospitalization for heart failure and lower all-cause mortality within 24 months of follow-up than medical therapy alone, providing a new therapy for these patients. Now, we've talked about being concise and clear and having people look, for instance, at your figure and get exactly what it is. And the reason for that is because remember that the reviewers often have a lot of abstracts to review. It's not uncommon to do 60. They are not always expert in your specific topic. So you may get a cardiologist expert in clinical trials, but not cardiogenic shock. So be sure that you tell them very clearly what the background is and why you're doing the study. Unfortunately, many reviewers wait to the last minute and do them late at night. So when you think about all of this, it again emphasizes why you want to be concise and clear in each of your sections. So again, I want to talk just a little bit now about presenting. Who is your audience? We need to think about that in the preparation of the abstract and also as you're presenting, because the presentation allows you a bit more space than the abstract itself. So who is your audience? And some presentation tips about a poster presentation and a podium or oral presentation. So your audience are generally your colleagues in cardiovascular medicine. There's the potential mentors and collaborators, so you want to explain your study clearly. There are those that are there in updating their clinical knowledge. They're interested in updating their knowledge in cardiogenic shock. And those interested in updating their knowledge in the science of cardiogenic shock. So there's a lot of different reasons why people are interested here. And you want to be sure that you just, with your background, you bring them to the point that they understand why you're doing it, that they clearly understand your hypothesis, and that they understand at the end, what are your conclusions and how do they contribute to the field and patient care. Remember, again, your colleagues are not always expert in your specific topic, but they're helpful in presenting comments. And often they're most helpful. I think we always think, oh no, I got a bad comment, but they are often more helpful when they bring up actual problems with your work. So you want to look at actually when you get critiques or questions that are important, that's even more helpful when they bring up problems. And because it really helps you focus on the issues. And this is why it's also one important reason that we'll get to when poster presentations. So don't be disappointed. Sometimes we're disappointed when it's not an oral presentation, when everyone can't see us, but don't be too disappointed, because often you have the best interactions at a poster. The person comes right up to you, you get to meet them, you get to introduce yourself. and very often they can ask 3 or 4 questions, whereas a podium presentation, often there's just time for a few questions and there can't be follow-up questions usually. This is also important for both poster and podium presentations, why you want to take time to do your abstract, because ask the colleagues on your poster what questions might be asked. And you should also, as you're preparing for the poster presentation, practice it at least 1 or 2 times in front of colleagues. If you're a fellow, maybe some of your fellows and some attendings, some of the attendings who may be part of your poster, and ask them to ask you questions so that you can have a list of questions you may be asked and be prepared to ask those. It's always nice when you have a list of 4 or 5 likely questions and you're prepared to answer those. Now, also when you present a poster, you're usually in a grouping that has similar topics to your own poster. So make it a point, if you're not talking to somebody right at the time, to meet some of the other presenters in your poster area, because remember, they're interested in the same things that you are. And finally, we're all nervous the first few times we do these, but remember that you're actually getting to present your science. What you want is feedback, and enjoy the process. So podium presentation, many of the same tips, but timing is particularly important here because you have to do this presentation. And I think it's often best, as you practice it, and you should, to get the timing right, it's often best to be 30 seconds short of the actual time you have so you don't go over. Because as you know now, many places will just cut you off your presentation, and you never get the time to really express your conclusions well if you go over. Therefore, you should probably have a script and practice it when you're new at this. And then you can change it. And again, practice it with your colleagues a couple of times to be sure that you have the timing right, that you're not speaking too fast or too slowly. And the practice is very helpful. And it also gives you much more confidence as you present. Then prepare again for likely questions. Ask your colleagues again, please help me with questions that you think will be most commonly asked. Most programs have a practice session where attendings and fellows get together and preview presentations prior to a meeting. And their job is to ask a number of questions to prepare you for the presentation. Be happy about positive and negative feedback. And again, I think enjoy the process. You're presenting, you're looking for positive and negative feedback because you want your subsequent manuscript to be the best it can be. So finally, I hope this encourages many of you to participate in this, to ask for data, to write an abstract from. There is another request for proposals due February 15th of this year. And you can be on the website. If you're interested, I think you can contact any one of us on the steering committee. We're happy to give you some guidance. But I think this is a huge registry now. A number of papers are in progress, but there will be enormous amounts to be just in case you need the barcode, or visit heart.org/cardiogenic shock. Thank you very much, and I'd be happy to answer any questions.
Thank you so much for that wonderful presentation, Dr. Lindenfeld. At this time, we'll be taking questions in the question pane. I do have a couple here that we can start with. Dr. Lindenfeld, how should authors approach abstract submission when results are null or negative?
Important point. So you should still be declarative in your title. And I would point out that sometimes neutral studies, I think we have to say the difference between neutral and negative. Neutral means there's no difference in your, the hypothesis does not show a difference, say in an intervention, whereas negative in many people's mind means that there was a negative effect. But I think you would say some of the more important studies have been studies that show us that this treatment or this therapy is not beneficial. So I would present that. We always like positive results, but neutral results very often about a treatment or a therapy or a device are really important, really contain important information. So I wouldn't feel bad about presenting that. I would present that with the same enjoyment and confidence as a study that has positive results.
Thank you. And then how can presenters anticipate and prepare for challenging questions?
So the best way to prepare for those are to do a presentation in front of your colleagues, number one, more than once, and ask them for the hard questions. And the other thing is that your colleagues, also when you send out the abstract, it's very helpful to say, please review the abstract. And if you have a minute, tell me some of the questions you think might be asked, some of the difficult questions. And then I would encourage you, if it's the first time when you have a list of those questions, then to write out the answers and present the answers. Have someone in the audience after you present the second time ask you some of those questions and give yourself some practice in answering the questions.
Fantastic. How should authors balance clinical reference with methodological rigor in a limited word count?
Well, that's an important and often difficult question, but in the methods you have to say, you'll have more time to do that in the presentation. So I think that you often have just time to say what type of trial it was, the timing of the trial and the number of patients in the trial. And then your primary endpoint may often be in the methods. So that's about all you have in the anything that's more important, you'll have time to do in the presentation, or when someone attends, if it's a poster, someone attends the poster. So you can't put it all in, just put the critical things in. People will understand that it can't all be in there in a poster.
And then what are the most common reasons abstracts are rejected?
I would say probably the most common reason is that the hypothesis and the conclusions don't really follow. The data are uncertain, that it's just not clear what is being presented. So I think that you have to, in the background, make it understood by the reviewer why this is an important topic. So I would say that one, the abstract is poorly written, there's typos. That's probably number one. Number two is that it's not entirely clear that your data support your conclusions. The data aren't clear. And so I would think those are the two most important. I think a good neutral trial, if there's equipoise about a certain question in medicine, for example, and when I pointed out, should intra-aortic balloon pumps be used in people with heart failure, cardiogenic shock? If you point that out, then the reviewers will understand that a neutral study is important information, if little is known about that topic.
Excellent.
So the most important thing is having a well-constructed, concise, to the point abstract that you can look at and understand exactly why did we do it, what did we do, what were the results, what is our conclusion.
Terrific, thank you. That seems to be all the questions that we have. I'd like to thank you again, and I'd like to thank everyone for attending. And then once everyone leaves today's webinar, you'll receive an email with a short survey. We truly appreciate if you would complete that and provide your feedback. You'll also receive a follow-up email within 2 hours with a link to review the recording of today's webinar. We would appreciate if you would share that with your fellow colleagues. Thanks for joining us. Have a great day.